So books, hardbound, paperbound, or tablets, screens, but it becomes a double-edged sword. How do you stop or tell a parent or explain to the parent that एक तरफ
मत
से हम बोल
पढ़ाओ.
रहे हैं आप उसको स्क्रीन बंद करो, बट स्कूल में बोल रहे हैं कि आपको अपना देयर आर स्कूल्स, देयर आर आई नो देयर आर हाई एंड स्कूल्स इन दिल्ली दैट
Yes,
एनकरेज
yes.
ऑल वर्क ओनली ऑन देयर टैबलेट्स.
Yeah, you would not believe मेरी जो हाउसमेड है उसके लड़के को all the homework comes on parents' phone.
यस.
So from that phone they don't send a printed sheet. It comes only via WhatsApp on her phone. Okay, so
let me
naturally they
stop you
have
there.
to
That
see
becomes
that.
very interesting. Why? Because going to training in MBBS or MS when you were a student vis-a-vis when we were students. So do you think that we can do our training without WhatsApp right now? Or can you run your hospital without WhatsApp right now?
So you can't run a hospital without computers today.
Yes.
But there are ways to use computers. So everybody who needs to use monitors, computers, laptops, iPad or whatever needs to follow the 20-20-20 rule.
Yes.
And the 20-20-20 rule says it's a simple rule. Every 20 minutes of doing any such intensive work, take just 20 seconds break to look at 20 feet distance and blink as often as you can. So simple rule, if it's followed, that also prevents a lot of such problems of dry eyes as well as progression of myopia.
Okay.
Difficult to implement because we usually tend to forget.
Yes.
When you are working, when you are engrossed in a game, you don't remember where the time flies and you don't blink enough. It's also leading to a lot of shoulder and neck issues,
Yes.
which is together known as the computer syndrome. And this needs everybody who needs to work on monitors, computers, phones need to know about and be careful about.
Agreed, ma'am, because there are so many IT professionals coming to us who tell us that we work 16 hours on the screen, and 16 hours out of 24 hours, I
It's-
don't know when they're sleeping, firstly.
Exactly.
And then out of
And when
16
are they eating?
Yes. So our normal blink rate is 12 to 16 times per minute. So once you're looking at a screen and we're engrossed, we are blinking much less. So of course we are bound to have that dryness. So do you encourage all these people who are working on the screens to use lubricating eye drops? Should they self-medicate?
So if they can't follow the 20-20-20 rule, at least use the lubricating eye
Yes.
drops so that you'll remain more comfortable and use them in a way where you are not harming your eyes. So make sure that you are not touching the tip. Make sure that you are changing the bottle after a month's use. And make sure that you are using them regularly so that the bottle doesn't even go beyond 1 month.
Okay, I'll touch on to a little more controversial topic, ma'am, but you don't answer it as medical advice. Just answer it to me as whether you would use it or not. So there are a number of patients, I would say majority, who middle-aged patients who come to us and they get us a number of drops, which are Ayurvedic formulations, homeopathic formulations. I have nothing against Ayurveda or homeopathy, and I'm being very clear that I actually I am. I will not say they are. I would say they run parallel to our medicine
Yeah,
field,
it is.
and you can't deny. But do you think that these drops will have any ill effect on the eyes?
So I personally don't like to use.
Okay.
And there are reasons. One is sometimes the formulation is not correct.
Yes.
So they can cause harm to the eye.
Yes.
Secondly, always the mechanism of action is not clear. So unless I know how it is going to work, I don't like to use that product. And I also don't believe that something has only good effects, like our old Hindi cinema actors or
Yes.
heroes and heroines, and no bad effects at all. So our old Hindi cinema actors were all of the below. They were good sons, they were good husbands, they were good persons, they were good fighters, they were good dancers, they were everything good.
Yes.
And no evil part at all. And we all know that such people don't exist. It's a myth.
Yes.
Similarly, we cannot have in all the good effects with no other effects at all in any of the pathis. And therefore, anything that you use needs to be logically and thoughtfully used.
Yes, because yes, definitely, eyes are the window to the world, and of course, without eyes or without sight, it's very difficult to live it. I think it is uh, one of the most difficult handicaps to deal with if someone is visually challenged, and we know how difficult it is, and especially being ophthalmologists, and
No, and you also know there was such a popular brand which was banned,
yes,
and
yes,
and for a reason.
yes,
So it does not happen without reasons,
yes.
right?
Okay, ma'am. So if I come back again to the myopia pandemic, so do you see that the need for refractive surgery is going to increase? And also, I want to add that after COVID, we at least in our practice have seen a surge in the requirement or the demand for refractive surgery. Why do you feel that is?
So one of the reasons is, of course, the more prevalence of myopia.
Yes.
The second reason is that the techniques today have become really good. So sometimes you can get better quality and quantity of vision than your own glasses or contact lenses.
Yes.
And therefore, people prefer that. Plus, there is also the convenience of not needing to use glasses. And the fourth thing is that contact lenses can answer some of the problems of glasses of minification or restriction of field of vision. But contact lenses themselves have other set of complications possible, including allergies, infections, and permanent dryness. And on top of that, cost of the contact lens, cost of the glasses,
yes.
cost of the solutions, and to maintain them properly, to keep them safe, to make sure that you're washing your hands before handling them.
Yes.
Everything is a
hygiene.
task.
Yes.
Especially if you are somebody who is a high flying executive.
Okay.
You are one day here, tomorrow there, and flying all the time. The chance of dryness also increases a lot.
Yes.
So, for such people, they find refractive surgery to be a very easy procedure
Yes.
because it's giving them that freedom from glasses without any much, tags attached to it.
Okay. So, ma'am, a lot of patients do come to us. One of their questions once we are counseling them for refractive surgery is that, will I be able to undergo further surgeries if I ever require, let's say, cataract or a retina surgery after LASIK or a smile? What's your take on that, ma'am?
So, corneal refractive surgery is done, as the name suggests, only on the cornea. And the cornea is the first lens of the eye. So, if you look at your eye, the central black portion is covered by a transparent layer. It's just like the glass of your watch. So, your eye appears blue, brown, only because of the color of the iris, which is behind that cornea. So it's exactly like the dial. The dial color tells you that this watch is black or blue or golden, but it is covered always by a transparent glass. That glass is what is getting worked upon. So the rest of your watch is remaining untouched. So whatever happens to a normal eye can still happen to your eye after the procedure. So if it's going to develop cataracts at 70, it will still develop. If it's going to develop glaucoma, retinal problem, presbyopia, reading glasses requirement, anything and everything that a normal eye can get, you are also going to get.
Okay.
But all the treatments that a normal eye can undergo, you can also undergo, because essentially your eye remains the same.
And also, I want to bust one myth that in an eye transplant, which is commonly said as an eye transplant, we don't transplant the eye.
Yes.
It is this glass of the watch or the cornea which is transplanted. We don't transplant the entire eye as a whole. Yes, there have been some early research that is trying to give us a retinal implant, but those are still, I think, in the early phase of research, and they will probably take some time.
And it's sad that very few people have asked me this question before undergoing corneal refractive surgery, whether they can still donate their eyes. And my answer is yes. You can still donate your eyes, and your eyes can still be very useful. So please pledge for eye donation after your death.
And before I sign off, if not an ophthalmologist, what would you have been?
Oh, I would have done a lot of things, which I'm still doing as a side thing. I would probably have been a choreographer.
Oh,
I
wow.
love dancing.
Yes,
I
yes,
do choreograph dances at a small level just for
Yes.
family functions and all. And I'm still persisting in practicing on my own and looking and having audience also as one person myself. But
No, ma'am,
that's something that probably would have been an alternate career
No,
for
we've seen
me.
you at our get-together, ma'am. You have a very wonderful choreography, ma'am. It's amazing.
Thanks.
And of course, for ma'am's patients, there are a number of patients throughout the world. I hope you could see through the lens and see inside Dr. Rupal Shah and beyond an ophthalmologist. Thank you so much, ma'am, for
Thank you,
being...
Raghav, for this was such an opportunity. Thank you
Yes,
so
ma'am, it was,
much.
honor was all mine. It was so amazing to speak with you. And I hope we catch up again soon. And so here we are signing off with the queen, or the mother of smile in India and the
Bye-bye.
world. Thank you.